So apparently, I just looked into the how many hours you can keep a nurse. Well, I guess many states have implemented mandatory overtime for nurses as long as necessary because of the nursing shortage. So let me just make something very, very clear, crystal clear. I don't give a shit what the nurses union says, American Nurses Association. By the way, they blocked me, of course, because I'm telling the truth. And they don't like it. Otherwise, they wouldn't have blocked me. But all of these people, all of the experts, all of the hospitals will say, we have a nursing shortage. Doesn't that work conveniently well for the directors and the CEOs? Yes, it does. To pay less money. It's the truth. They should not be allowed to operate. If they are not going to have enough staff for an acute unit of patients, then they should not be allowed to operate, period, or keep nurses in mandatory overtime. Furthermore, there are plenty of nurses. COVID did not drive nurses out. Nurses have been being driven out by American Nurses Association, National Nurses United, because they all got on board with the same agenda, even if you don't realize it and you are in one of those unions. They are, okay? It's very simple. You need to stand up. There's plenty of nurses. They have American Nurses Association since their inception, and they're an alumni, by the way. Yeah. Nobody really appointed them or voted them into anything. Maybe you did within your nurse group, but as far as our country, they're not elected to anything. They have been using, and so have the hospitals for, 50 years. Nursing shortage. No, there isn't. Nursing schools are filled with nurses. Hell, when I was in, I got in because it was a lottery. Yeah, you picked. You got your name pulled. That's how many people were, at least for the school of your choice, that's how many people were getting into nurse. There still are. There is plenty of nurses. But the hospitals, and this is why the unions are not telling the truth, is because they help the hospitals. They say it too, we have a nursing shortage, so you have to do this. No, there's not. They just don't want to hire people. Because this way, if they don't need to have more staff, then they don't have to put them on call, and it's cheaper. It's all about serving the money pockets of the CEO, which I would say most of your unions and American Nurses, they're just getting kickbacks for going along with it. I mean, hell, they're all with the UN. But there is not a nursing shortage. There is not. They will tell nurses this forever. It's old. It's bullshit, okay? They are the ones that have driven nurses out because the CEO doesn't want to have to pay. He would rather on a day when they don't have as many patients, this way they don't have to put anybody on call. This way, I mean, we used to have a list of people you could call in. They don't have that anymore because over time, because the CEOs become more criminal and depraved in their behavior, and people go along with them, they just want to make life miserable. They really do, because I truly believe that's what it is, because they are miserable. They have a love of money that has run their entire life to where they have no heart. They never consider anybody else, but they have the audacity to talk about, these are our hospital values and philosophy. Oh, can I vomit? So they've implemented mandatory overtime in many states. And if we had a justice system, a government that was willing to hold the CEOs accountable for their lies and put them in jail and not believe their bullshit about a nursing shortage, but actually hold them accountable that, I'm sorry, but your unit just cannot be open if you're not going to staff appropriately, because you're putting people in danger. But these CEOs, many of them, they should have, especially these ones that have the long line of abuse, especially the ones that have chief nursing officers that emotionally abuse a kid and set nurses up, okay? Any people like this, or CEOs of big university hospitals, okay, that will keep violent employees but go out of their way to get rid of honest ones. All of those people should face jail time for many reasons, because you have to be a criminal mind to do that. criminally minded. That's what needs to happen. And so if I'm the boss, right? If we're the boss, if we, the little people, the average people are the boss, then I demand that the government, not that they will, of course, but demand that the hospital CEOs be brought up on the charges they should have been brought up on years ago. I mean, there's plenty there with them getting on board with the UN and many of them getting on board with China, okay? Slowly over time bringing the communist system in. What do you think they do in China when nurses go to work? Do you think they just can complain when her support doesn't come in for the next shift? No, she's stuck because it's communism, exactly what the hospitals have wanted to bring in, many of them anyway. So nurses need to stop believing this bullshit. I don't care what paper it is. All of the experts are full of shit. There is not a nursing shortage. There's plenty of them. And you would bring many of them back. They just got tired of being treated like crap and being told the same bullshit over and over again from every damn hospital, from American Nurses Association, from Magnet, from all of them that are supposedly your advocates. No, it's very simple, especially in psych. Okay? Even if you don't want to have patient or staff ratios, okay? When you start having employees that are abusing children or abusing patients, or a nurse that's getting hurt, she can't take a break. If a nurse cannot take a lunch break, a 30-minute lunch break, or go to the bathroom, then that hospital should not be allowed to operate. Because I don't care if you give mandatory overtime. It doesn't say that you are allowed to treat your employee like slaves. But that's what they're doing. And so every time American Nurses Association and National Nurses United and Global Nurses United, all of them, and these hospitals say, well, we have a nursing shortage and we have to have mandatory overtime. Yeah, ask them, well, then why is it just in a 12-hour shift I can't even get a bathroom break or take a 30-minute lunch, which I'm entitled to? But you want to demand I'm going to stay over? Yeah, have them answer that, because they won't even staff enough for a nurse to come over and give you a 30-minute break. So, yeah, they need to go to jail. I'm sick and tired of it.